But I'm a little nervous this morning for a couple of reasons. Number one, I'm a Dodgers fan. And so all the predictions about the Phillies winning, I was at the playoff game here in Philly, dressed from head to toe in my Dodgers gear when Jimmy Rollins did what I consider the unspeakable. I never felt the stadium shake the way it did here. You know, overall there is a sense that there's tremendous fighting, there's tremendous division, and there is an inability to solve the hard problems, to make the changes necessary to solve the hard problems. And that's indeed what the president is facing. So let me talk a little bit more specifically about the president and his agenda. And I'll start with health care, because this is obviously of great interest around the country and is a top political issue right now. So why is the president, with all of this headwind against him, trying to restart the health care debate by offering, as he did, a repackaged slightly health care plan still to the tune of about $1 trillion? Why? Because the downside of not doing it is tremendous. So why restart it now? Because frankly, they are close. And if they don't achieve something, if the president came out and said, this is my signature legislative accomplishment and legislative goal for my first year in office, and he can't achieve it, then the winner reaps the spoils. The winner gets to define the terms of the defeat. So the president's view was twofold. One is, if we do nothing, we get all the downside and we get none of the upside. The other belief that they have in the White House is, if they're behind on the argument now, the only way to win the argument is to get the bill passed. Because what, again, is unpopular about the health care debate is the process of the health care debate, not the elements of health care reform. There are some things that are more popular than others, obviously. We talked about, a concern about additional taxes, which is going to be a concern for business. It's going to be a concern for those with higher-end plans. It's going to be a concern for the middle class, or for those who would be penalized if they don't buy health insurance when there's an individual mandate to do so. But expanded coverage, forecasts that ultimately this can be deficit neutral, they can bring the deficit down, the prospect of a down payment on containing some of these runaway health care costs, all of those are to the good. But the process is really ugly, because again, the bet that the president made when he came into office is things are really bad, people are really scared, people don't like where the country is headed, there's a crisis atmosphere, government is uniquely in a position to lead. Government can make the, intrusions into the economy to rescue the economy through stimulus, to regulate the economy and financial services, to control some of the excesses that got us into this economy in the first place. So government has a unique opportunity, this kind of Big Bang theory, a social transformation opportunity because of this pivot point. But I think what we found is change is hard. People are not as interested in this kind of social transformation when they're worried about whether they've got a job, whether they can get a job, whether they're going to lose their job. That's the principal fear. So that overhang of social transformation became really scary to people at a time when people have less and less confidence that government can actually pull it off. And since most people don't have any idea how the healthcare system works, people have no idea how their own healthcare works because we don't pay for it. Why mess with what I've got or do something that's going to end up costing me more or affect my coverage one way or the other? So if you put some of these things together in terms of the president's performance, what hurt him a great deal was this, what Governor Rendell talked recently about, this loss of the narrative for the president. What's he focused on? What's his primary function in the job that he's doing? It's got to be getting people back to work. Now, I think it's a misnomer to say that he was not focused on the economy from day one. Of course he was doing that. There's only so much the federal government can do, as business leaders you well know, to affect hiring. Most of you in this room, I would presume, would favor less government intervention than more government intervention in terms of being able to affect hiring and being able to affect the business cycle. So a massive stimulus, which frankly most economists believe did have a positive impact. They certainly misjudged what the performance of the economy would be. They made the interesting choice of predicting that with the stimulus program they'd keep unemployment to 8%, which didn't turn out so well for them. But nevertheless, it has had an impact on the economy. But politically, saying things could have been a whole lot worse isn't a great sales point at the moment. So losing control of that narrative, having that singular focus of getting people back to work is something that the president appears to have lost. In the process, he is caught in between incredible polarization on the left and the right. The left disappointed with him for not, for even speaking to Republicans in some fashion on health care reform. The right with a constant mantra of this is an expansion of government, this is a socialist government, making it very difficult for any kind of bipartisan compromise, both ends of that. And then the middle, these independent voters, many of whom are Republicans, the notion of an independent center being smaller than it used to be in the past, just uncomfortable with the idea particularly of the deficit. $12 trillion in debt, $1.4 trillion in a budget deficit, deficits that will only grow over time even after they shrink somewhat in the 10-year picture. So it's a very difficult environment in which he'll move. What I think will happen on health care is that the president will not stop until he gets something. I think they'll use budget reconciliation. They'll take some heat for that, although the Bush administration used that to get tax cuts through. They'll get something done on health care. I want to talk for a minute in closing about my time in Meet the Press, which is the most exciting and wonderful job I've ever had. And I've really been appreciative of the support that I've had in this new role for what was an unnatural transition after the loss of Tim Russert. Americans in this media landscape and in this political landscape still want a place to go to have thoughtful, balanced conversation, who want to get away from some of the polarization that's in our media and in our politics and have constructive engagement, have solution-oriented conversation. Because amid all of this discussion about whether a third party is possible again, whether there's another Ross Perot on the scene, there is a great hunger for people to take on hard problems and offer real solutions. We've got a debt of $12 trillion. The biggest drivers of that debt are entitlement spending, health care costs, and yet nobody in Washington is really prepared to sacrifice. That's the hardest thing. What are you prepared to give up? Where is the candidate who's going to go down to Florida to a senior center and say, we're going to cut your benefits? And here's why. Because if you want your children who are in their 40s and 50s to access any of these entitlement programs, you're going to have to give a little bit. Very unpopular to do that. And until, if it stays that unpopular, if it remains that difficult for politicians to make those difficult choices without the fear of repercussion, then it's very difficult to see a horizon out there where there can be a whole lot of change. You know, right now, I go back to the conversation I had on Meet the Press this weekend. I had a Republican and a Democrat, and I asked them, you know, what's going wrong in Washington? And what you heard were entrenched positions on both sides. And you think, well, why can't somebody give a little bit of ground here and admit some mistake? And the truth is, there's no upside to doing that back in their districts where they're from. There's only downside to doing that. You know, it was said of Senator Kennedy that the impact he would have had on the health care debate is that he would have never been accused by the left of selling out the liberal agenda because he had such credibility. So the liberal lion, the senator from Massachusetts, had an ability to cut deals with Republicans all the time because back home, compromise would be accepted because if he said it was okay, then it was okay. That spirit in politics has been lost. And, you know, a lot of us enjoy the combat of politics, but when it comes to actual solutions and problem solving, there are real problems in Washington. They require bipartisanship, yes. They also require leadership on both sides, yes. So there's a lot of work to do, and it remains an uncertain time. But Meet the Press is a place that I hope you'll keep coming to sort these issues out, to hear the issues raised, and not just the problems raised, but also some solutions raised as well. So my thanks to Dennis Bianchi for having me here and being such a great champion of Meet the Press here in Philadelphia. And I look forward to being back, whether or not the Phillies bring home the trophy. Thank you all.
Thanks so much.
You bet.